Medical laboratory technicians or clinical laboratory technicians. These individuals may perform designated tests and procedures, prepare specimens for testing and transport, prepare reagents, perform quality control measures, perform some testing, and assist the clinical laboratory scientist in numerous processes. Certified specialists are individuals who complete required experiences and a certification examination in a specified area of the laboratory, such as blood banking, hemopheresis, microbiology, clinical chemistry, hematology, laboratory safety, laboratory management, etc.
Hey, I'm Mark from the lab, and I'm here for that venipuncture, and how you doing?
Oh, I'm all...
That's great. You been fasting?
I'm not sure what that means.
That means when was the last time you ate?
Dinner last night?
Good. State your name and spell it for me, okay, sweetie? Good morning. I'm Mark from the lab, and I've come to collect a blood sample today.
Oh, all right. The nurse said you'd be in.
Great. When was the last time that you ate?
Well, I had some dinner last night. Nothing yet this morning.
Good. I just need you to state and spell your name for me, okay?
Masks, protective eyewear, or face shields should be worn to prevent exposure of mucous membranes of the mouth, nose, and eyes during procedures that are likely to cause droplets or splashes of blood or other body fluids. Gowns protect the healthcare workers' clothing from being exposed to body fluids. As with all PPE, be sure to follow proper gowning and masking procedures. The gowning and masking procedure begins with a washing or sanitizing of the hands. Anticoagulant drugs like heparin and Coumadin suppress clotting factors, so they are used to treat patients with coagulation disorders. Also, many elderly patients take aspirin to lower the risk of a stroke. Aspirin also inhibits the coagulation process. This is important for you to know because if a patient is on anticoagulant medication or is regularly taking aspirin, he or she is more likely to bleed longer after the blood specimen is collected. Excessive bleeding is another area for concern. Normally, a patient stops bleeding at the venipuncture site within 1 or 2 minutes. Patients on anticoagulant therapy and/or those taking high dosages of arthritis medication or other medication, however, may bleed for a longer period. As mentioned above, coagulation abnormalities can also cause excessive bleeding. Take a deep, cleansing breath before beginning the patient encounter to help clear your mind of any unwanted distractions. A clean and neat appearance instills confidence and professionalism in both yourself and those you work with. Preparation of the workspace is also important. The area should be clean, free of contaminated items, near a sink, and with access to biohazard disposal containers. The phlebotomy chair, recliner, or patient bed should be in a safe, comfortable position for both the patient and the phlebotomist. Always ask if a patient is sensitive or allergic to latex, and if so, use non-latex alternatives. Needle stick injury prevention is another crucial safety consideration. As a phlebotomist, you use needles in your day-to-day work and thus are at increased risk of a needle stick injury. Needle stick injuries may lead to serious or fatal infections with bloodborne pathogens such as hepatitis B, hepatitis C virus, or HIV, so preventing such injuries is of paramount concern. Compare the information stated with the information on the laboratory test requisitions. If there are discrepancies, report it to the responsible supervisor. Discrepancies in patient identification information must be resolved prior to collecting the specimen. Never collect a specimen if the patient's ID is not confirmed or if discrepancies have not been fully resolved. Confirm the information with another source of reliable, verifiable identification. Hold the needle assembly in one hand while the thumb of the other hand anchors the vein 1 to 2 inches below the puncture site. Orient the needle in the same direction as the vein and at an angle of 30 degrees or less with the skin surface. With the bevel side up, Insert the needle quickly. A slight pop should be felt as the needle enters the vein. As blood begins to flow into the needle assembly, have the patient open his or her fist. You may now release the tourniquet. Once the slides are dry, label them and prepare them for safe transport to the laboratory. Remember, if these slides were made at the patient's bedside, they are considered hazardous. With the procedure complete, you may now discard any unusable slides and all biohazardous waste in an appropriate container. Finally, some blood specimens, such as those collected for bilirubin analysis, require protection from light to prevent the analyte from breaking down. Protect these specimens from bright light with a commercially available amber or brown biohazard bag, with an aluminum foil wrapping around the tube, or with a light, tight transport container. Again, transportation to the laboratory should occur as soon as possible after specimen collection, and specimens should be handled gently. If the child has a favorite doll, blanket, or toy, he or she should be encouraged to hug it for comfort and support. Establish guidelines. Tell the child and the parent that the procedure will most likely be successful on the first attempt. If not, it will be attempted only once more by another healthcare worker. Be honest when a child asks if the puncture will hurt. Tell the child that if the procedure hurts too much, it can be momentarily stopped, but that the quicker the procedure is performed, the less painful it will be.